sometimes getting that care into Montreal, it's a whole coordination, especially when you're not in the same province.
When Jessica Quinlan's son Raiko was born with osteogenesis imperfecta type 3 severe or brittle bone disease, she and her husband had to make 8-hour trips to Montreal for the ultra-specialized care he needed at the Shriners Hospitals for Children Canada. Doing this multiple times per year, being away from work, school, and their 4 other children in London, Ontario. But on Friday, 2 major pediatric hospitals joined forces, the Shriners Hospitals for Children Canada and the Children's Hospital at London Health Sciences Centre in Ontario, announcing a first-of-its-kind affiliation agreement so children like Raiko can receive care closer to home.
It's so important, especially in those early years when, honestly, when you have a medically complex child and for other parents with children with OI, it's so nerve-wracking traveling with your child.
Many gathered at the hospitals in Montreal and London for the announcement. Clinical care, research, and education, the 3 core pillars of the affiliation.
They're literally just an email and a phone call and a text away. And I could, if needed, in an emergency, I can be there within an hour.
That'll be the new reality for other patients with complex bone disorders and their families in southwestern Ontario, now being able to receive treatment at a specialized monthly clinic at the LHSC rather than traveling hours to Montreal.
Patients can be seen closer to home, the better it is for them, but at the same time it will free up time here at this hospital to see more patients here. And most of our patients are from Quebec, so most of those freed up spots and time will be for the Quebec patients.
Scientific teams from both hospitals will also come together in a joint quarterly conference discussing ongoing research developments and future collaborative projects.
The training that people get for this sort of thing is going to benefit patients everywhere, not just in Quebec, but in Ontario, and if we can do it more across the country.
Joint quarterly education rounds are also underway, where surgical teams from both hospitals, including medical students, residents, and fellows, will help find solutions to complex cases. After over 1,000 fractures and 16 surgeries, this affiliation will continue to help Raiko and many others feel at home.
He doesn't want to be the patient. He wants to be Raiko, the 14-year-old boy.
In Montreal, Pamela Pagano, City News.